This morning, more people are calling a mental health crisis line, and it's getting ready for another surge. This weekend will mark a year since the new mental health crisis line went live. 988 is a national emergency line like 911, but for mental health calls. Christy Diaz has more.
Since 988 went live in July of last year, call volume has increased 12%.
So a tremendous increase in the number of people calling for help.
Tiana Bridges was one of those people.
I was like, I have pills in my hand right now, and I really want to take it. He was like, no, let's talk, let's breathe first, and then let's talk about what got you to this point.
It didn't solve everything, but that 45-minute conversation lifted her out of darkness and started her in a new direction.
It just made me feel like I'm stronger, I can beat this.
There are over 200 crisis centers nationwide where people answer these calls and texts. Kevin Tanner, the commissioner of Georgia's Department of Behavioral Health and Developmental Disabilities, says in these moments, seconds count, which is why he's so proud they've improved call response time.
So we've been able to bring the time to answer the call down from 200 plus seconds down to on average just over 7 seconds over the last several months.
The next step, he says, is to work on the mobile units, the two-person team that responds to a crisis call in person.
The goal is to reach everyone in Georgia within 1 hour. We obviously have not met that yet. We're working toward that.
They're also working to get the word out. 35% of people in Georgia have heard of 988, but only half of those people understand what it is. As they start educating and marketing, they expect call volume to increase.
Even though we're answering those calls in 7 seconds, as the call volume increases, and we know that it's going to, we're going to see that answer time start ticking up, which means we need to invest and be ready to answer that call.
To help get the word out, Commissioner Tanner will travel around the state to meet with sheriffs to talk about 988 and make sure they know it's an option too. As the calls and texts increase because of that, they're looking for providers, nurses, and social workers to answer these crisis calls and texts. He says that is one of the biggest challenges they face right now.
All right, getting the word out important, so they've gotten some progress over a year, but we need 70% of the population to know this important resource is out there.
And just seeing that they were willing to talk to that young lady for 45 minutes really shows that they're committed and they're there to help these people.
Yeah, these are trained counselors, a clinician as part of the mobile unit. So these are trained people that are there for you, and that's the biggest message of all.
Meeting an important need.
Yes.
Christy, thank you.